Hello and welcome. Let's talk about Mastalgia. So, what is it mean by Mastalgia? Pain in the breast is called Mastalgia. Now, types of Mastalgia. It may be cyclical, non-cyclical or chest wall pain. Cyclical Mastalgia, when the pain intensity is changing during the menstrual cycle. Non-cyclical Mastalgia, when the pain remains essentially unchanged during the menstrual cycle, and this is less frequent. Now, causes. It may be due to mastitis, breast abscess, fibroadenosis, cyst, sometimes a carcinoma, or the patient who are on hormone replacement therapy, caffeine, tobacco, or large pendulous breast. Now, investigations required. Hormonal assay which includes prolactin, estrogen, progesterone, and thyroid hormones, or mammography. Now, principles of treatment. For cyclical Mastalgia, cancer should be excluded, reassurance should be given, appropriate fitting and supporting bras should be worn throughout the day and a soft bra worn at night. Avoiding caffeine drinks, evening primrose oil for 3 months, danazol 100 mg 3 times a day, and tamoxifen. For non-cyclical Mastalgia, exclude extra-mammary causes such as chest wall pain, NSAID, and injection of the local anesthetic on a trigger spot. End of the topic.